if you have an operating room, which is a limited resource, and you can't efficiently allocate it to everyone, then there's going to be certain groups of people that can't get access to it. So one of the best ways to actually eliminate disparities in care is to just make healthcare more easily accessed. And by creating a bunch of OR time for people to get procedures, it actually brings the cost of care down. It makes it so that marginalized populations can access a treatment they wouldn't have been able to access, or that hospitals would be forced to ration to people that could pay the most. And so really the best way to eliminate disparities in care is just to make it so affordable and so accessible that everyone can access it.
Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a special guest with us, Dr. Andrew Gostine, CEO and co-founder of Artisight, a pioneer in AI-driven smart hospital platforms. Dr. Gostine is here to share how AI, ambient listening, and computer vision are being used to reimagine surgical care and perioperative workflow as part of a comprehensive smart hospital platform. With Artisight's groundbreaking collaboration with NVIDIA and Karl Storz, they're bringing cutting-edge automation and real-time insights to operating rooms around the world. Hey, Andy, are you ready to be our guru today?
Thanks for having me, Tom, of course.
That's great. We're real excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
I would say the future is female because I have 3 little girls, 6, 5, and 3 years old. So I'm working from home today just so I can get a chance to be closer to them, because then we're back on the road traveling for a whole bunch of conferences over the next 3 weeks.
Yeah. Fantastic. Those are great ages. A lot of energy going on there, right?
Too much energy.
Yeah, I feel for you. Fortunately for me, all mine are grown and out of the house. So, but it's a fun journey to be sure. So, congratulations with that. So,
thank you,
Andy. AI is really revolutionizing every industry, but healthcare and especially surgery is really undergoing a remarkable transformation. From your perspective, why is the operating room such a powerful use case for AI at the moment?
There's a lot of reasons. I guess most important to the overall success of our healthcare system is that most of the profits for a health system come out of the operating room. And if we can't fund the mission, then there is no mission. So first and foremost, it all has to do with the money. Operating rooms have huge backlogs, especially coming out of COVID, people that deferred care for a long time. This has contributed to disparities in care. We're seeing marginalized populations see an acceleration in the worsening of their outcomes. So really helping to unburden the capacity constraints that we see in the operating rooms is a dramatic financial improvement for the hospitals, which are under extreme margin pressure right now. But just in terms of the functioning of an operating room, there's very little that is actually measured, calculated, or quantified in the operating room. So being able to turn on the types of artificial intelligence we do, like computer vision, ambient listening, these types of perception, is really allowing us to measure things for the first time, which opens up very exciting opportunities for research to kind of raise the ceiling of what we can do inside an operating room to improve a patient's situation.
Yeah, that's fascinating. A veteran of about several hundred surgical procedures, mainly around robotics. So it's really interesting to sit and watch some of those variables, right? From staff members to surgeons to the patient to the equipment being used to surgical preferences, right? So there's a ton of variables there. So are you finding you're able to quantify that and help to create some standardization of workflow?
Yeah, even starting with just some very simple things of improving turnover, improving on-time starts, these things that really lack from intelligent communication systems. We've been able to improve things in a very meaningful way to where we're doing additional cases in the ORs. But most of what is unmeasured in the ORs is down to actual surgical video or the instruments that are used, the techniques that are performed. And because so much of that is unmeasured or left unquantified, there really is no way to know how much we can improve or optimize the cost structure and revenue structure of a hospital, or in taking that a step further, improving the patient outcomes. So we've seen tons of examples when people do actually attempt to quantify this with human labor, of being able to determine that there's different outcomes between two different surgical staplers. So being able to measure and then track the inputs against the patient outcomes, whether it's financial, functional, or even mortality, you can't ever figure out what's making a difference, what is really creating value, or what is just driving up cost until you measure these things. And so computer vision, which is a fraction of the cost of paying a human to monitor something with their eyes, is really the only way we're going to scale the data capture needed to unlock the opportunities that all of these problems present.
Yeah, that's fascinating. It kind of leads into my next question because doing my research, and as I mentioned in the introduction, you've developed a collaboration between NVIDIA and Karl Storz, right? And around some of that equipment, I would think. So, first of all, what inspired this partnership, and how do each of the companies bring a unique strength to the table in this collaboration?
So NVIDIA it obviously has had a remarkable last decade, although it really goes back to the 90s when Jensen kind of developed this concept of a GPU. But NVIDIA brings a ton of AI support to Artisight. We leverage a lot of their SDKs and toolkits. We leverage, obviously, a lot of their hardware. And they've put in billions and billions of dollars of research to make this foundation available to Artisight and everyone in the industry. So, for a lot of reasons that would take far too long, NVIDIA has been a phenomenal partner. Karl Storz, on the other hand, is installed in about half the intelligent operating rooms in the United States and has a global footprint in Germany, Japan, the United Kingdom, Singapore. And so it really gives us a global footprint. So bringing it all together, you have Artisight, which really specializes in developing perception, artificial intelligence, like computer vision and ambient voice listening. And we can take those tools into a HIPAA protected environment and, without violating anyone's privacy, make sure that we've optimized the algorithm's performance and accuracy for the particular problem we're trying to solve in that particular setting. So leveraging NVIDIA's technology, leveraging Karl Storz's footprint and distribution really allows us to scale the value we can provide with the solutions that we provide.
Yeah, that's fantastic, and what a great opportunity. And digging in it a little deeper, I noted the Pathway AI, which is a major milestone. Maybe you can now walk us through a little bit about how the technology works in the OR, from this ambient listening to some of the real-time alerts and automation, so we can understand those outcomes a little better.
With most things in healthcare, you have to crawl before you can walk, you have to walk before you can run. And you see these parallels in other industries, like with automotive. We didn't just develop autonomous driving systems overnight. This started way back in the 1800s when we invented the internal combustion engine. So healthcare is going through the same transformation. It will happen faster than autonomous driving, but still relatively slow in terms of a human lifetime. So what we really do is go into a hospital, and being that I'm an anesthesiologist, I'm intimately familiar with the problems here. We start by just passively capturing information for the doctors and nurses. So much of what we do is just data entry, and it really bogs us down. Plus, humans are imperfect at things like data collection. So expecting me to push a patient into the OR and then also document that I've entered the OR with the patient is really redundant. And if I have the choice between caring for the patient or documentation, it's always going to be caring for the patient. So what Artisight does in that situation is we have cameras that detect OR entry just by watching the OR. We will auto-document that for the surgeons, the anesthesiologists, the nursing staff, so that we don't have to waste our clinical time doing documentation. Now, oftentimes when a patient enters the OR, it's with a nurse. And the anesthesiologist and surgeon may be seeing other patients, not knowing that their patient is now waiting for them in the operating room. And it's a very expensive resource in operating room. So alerting people that they need to now report to operating room 4 to start that surgery is how we ultimately compress the surgical schedule to make it more efficient. So it's really detecting some very common perioperative workflows, patients entering an OR, starting anesthesia so that the surgeon can get alerted to come start the procedure, letting the cleaning staff know that we're about to wheel out of the operating room as we see the patient get onto the transport bed is one of the ways that we can send alerts to make sure that there's not delays in the processing sequentially of all the little workflows that need to happen to make the ORs really work. So Pathway AI is really this large coordination system that Karl Storz has developed, and Artisight makes it passive. Rather than doctors or nurses running up to touch screens and doing data entry and then texting the surgeon and texting the anesthesiologist, Artisight passively captures all of the data that's required by that system to make it something that functions in the background to automate workflows, communications, and data capture for the staff.
Yeah, it's really fascinating because for our gurus out there that maybe have not been in an OR, there's a lot of moving parts in every procedure, right? I mean, you're talked from, wheels in, wheels out, and getting coordinated with staff and housekeeping, and even something little like making sure you've got the right tray there or the right sterile drape or the back the stand is set up correctly, right? That helps with those efficiencies. So is that heading down the right track with what you guys are trying to coordinate and smooth out here right now?
Exactly. And so it started just simply detecting OR entry and OR exit of the patient to try to make sure that the time in between surgery could get compressed, and is really now advancing to understand hundreds of different events that happen in the operating room, down to which instruments did we use, were they in the OR at the appropriate time, and getting more advanced, like saying, we have 3 of this type of instruments. How many times this year were all 3 simultaneously being used with demand for a 4th? And if it turns out the demand for the 4th version of this that doesn't exist was only for 1 minute this year, then it becomes a very easy decision. Do we buy a 4th or do we just wait a minute? You can do the cost comparison. You took a problem that you had no way of knowing, is this 4th item justified, and made it a very easy database decision. So we've started with very simple things, and this is really now growing to where we're able to answer hundreds, if not thousands, of questions with the data that we can generate for a health system.
Oh, that's fantastic. And you mentioned earlier HIPAA compliance and patient privacy, right? And which are obviously top concerns in the hospital, and especially with new technology. How does Artisight ensure that its AI tools maintain this high standard for privacy and clinical autonomy? Can you give us some insights there?
Yeah, so we have a proprietary process for generating synthetic data. So we don't keep any video, we do not keep audio, we do not keep images. Our systems generate a synthetic version of the hospital, of images and things like that, to train algorithms. But because we retrain every algorithm at every client site, the false positives, the false negatives are very, very low, far less than 1%. You can't build systems for doctors and nurses and then have it just create a bunch of false alerts and notifications. So we put a lot of effort making sure that we could get very high accuracy. Now, because of HIPAA, you have to do that in a way that's very responsible, that protects patient privacy. And that was really the genesis that pushed us to develop this synthetic technique for training these algorithms. But we didn't want people to just have to believe us that we were actually doing that. So we underwent 2 third-party audits where we paid experts in computer vision and HIPAA and statistical de-identification through synthetic data generation to come audit all of our processes for doing this. And both of them gave us perfect scores on full HIPAA compliance so that we, again, could show health systems, legal teams that this is not something that you just have to believe we're doing. We've undergone all of the audits to show people we're actually doing it.
Wow, that's phenomenal, and congratulations for that. I think that's just an amazing step that you took. But I was intrigued too about some of the training, the model, right? Because there's an old saying of, if you've been in one hospital, you've been in one hospital, right? So how long does that training process take?
So, first to your comment, that if you've been in one hospital, you have absolutely only been in one hospital. And this is really the benefit of artificial intelligence. Before, people were trying to build systems like this just using very simple heuristics, and the heuristics did not generalize to every new hospital. But what's so great about artificial intelligence is that it is truly has intelligence, and it can understand the differences between hospitals. So this retraining process that we undergo to essentially make sure the software adapts itself to each health system and the uniqueness of it typically takes like 2 to 3 days. It's not a long process, but in those 2 to 3 days, we can see enough and listen to enough in that hospital to go after the tail end of edge cases that might confuse the system, that might be unique to that health system.
That's fantastic. And you mentioned some of your collaboration with NVIDIA and Karl Storz, and it's not just about efficiency; it's about equity, right? So, how is Artisight working to expand access and reduce these disparities in surgical care?
So, and this is the real reason we started the company. You know, I went to medical school because I wanted to do liver transplant anesthesia and take care of those patients in the ICU afterwards. And that was just very academically interesting to try to keep patients alive after such a huge life-threatening event. And what I realized was that if we couldn't make the ORs efficient enough to do the liver transplants, then there was really this huge gating function that kept me from doing the things that I wanted to do. And then if you work backwards to the extreme of that, you realize that if, like everything in economics, if you have an operating room, which is a limited resource, and you can't efficiently allocate it to everyone, then there's going to be certain groups of people that can't get access to it. So, one of the best ways to actually eliminate disparities in care is to just make healthcare more easily accessed. And by creating a bunch of OR time for people to get procedures, it actually brings the cost of care down. It makes it so that marginalized populations can access a treatment they wouldn't have been able to access, or that hospitals would be forced to ration to people that could pay the most. And so, really, the best way to eliminate disparities in care is just to make it so affordable and so accessible that everyone can access it.
Yeah, that makes total sense, right? So just getting more access by having more time available, I can totally see how that would work. And I'm curious, kind of building on that without giving away any trade secrets here. You're leveraging tools from NVIDIA and Pneumotron. I'm wondering how these advanced technologies enhance this functionality, with some of that real-time speech recognition. Can you take us a little deeper there?
Yeah, and one of the things that I think is probably not well known about NVIDIA is they actually have more software engineers than hardware engineers. So they really do put a lot of effort into building a platform on top of their hardware to accelerate the work that other vendors could come to NVIDIA for. And so one of the major benefits we get from working with NVIDIA's SDKs, like Riva for voice recognition or Nemotron for the video language models that we use, is that these tools have been optimized to run very performantly on NVIDIA hardware. And again, just like an operating room, we want to try to get as many surgeries done in that operating room. We want to try to get as much data processed on a single GPU versus buying a second GPU. And NVIDIA does a lot of the work to taking even open source algorithms like Llama and then optimizing it to run on an NVIDIA GPU to make it 25 times more performant, meaning we need 25 times fewer GPUs to actually run the algorithms. So one of the major things that people should go to NVIDIA for and do go to NVIDIA for is to make this very expensive GPU so performant that you can use one instead of 20. And that's what makes this now affordable for health systems to purchase.
Yeah, that's fantastic, and I'm just kind of curious now. And I know it's early days for you in many ways, but through employing some of this, have you seen like an aha moment where a surgical team realizes that maybe they were missing an area or developed a best practice that really created an outcome? Do you have a story around some of that?
Yeah. So, one of the things that we did more recently, about a year and a half ago, was start listening to the surgical timeouts. So, the World Health Organization requires hospitals at the start of every procedure, whether it's in an operating room or an ICU room or an emergency room bay, before you do something to a patient, just like you would in the airline industry, you pause for a second and review as a team, do we have the correct patient? Are we operating on the correct part of their body? And we've now seen now at several institutions, because we can listen to that timeout process with Riva in real time because it is performant running on a GPU, that we've had sites that said, hey, we're going to take out the left kidney. And it was actually the right kidney they were supposed to be taking out. And because we can process that with ultra low latency at the edge, we are able to tell the systems and the people in that room, stop, confirm before you go cut, because you're saying left, but the medical record system says it's the right kidney. And so we now have a few examples where we've actually prevented wrong-sided surgeries or from the wrong leg being amputated just because we're confirming all of these things. And if we don't hear it, we play a different alert in the operating room. Hey, you're about to start a procedure, but you didn't do the timeout yet. And so it's really raising the floor and safety for some very vulnerable patient populations at a very vulnerable time in their lives.
Yeah, that's phenomenal. And again, for our listeners out there, as I mentioned earlier, there's a lot of moving parts going on in the OR, right? And people are thinking, well, how could you, operate on the wrong leg or, go after the wrong kidney? But with all these moving parts, with all this communication, all people in and out, it can happen fairly easily, right?
Yeah, it happens more, unfortunately, than, I'm happy to report that it happens. But it really just comes down to the demand we're putting on the clinicians to do a lot of things simultaneously in a very stressful, high stakes environment. We still have physicians that are working 36-hour shifts. A lot of things can happen when you're sleep deprived, working around the clock through a global crisis that can really put pressure on people. These bad things can happen, not because we're not trying, but just because we have an unrealistic expectation of what a human can and should be doing.
Yeah, that's very helpful. And Andy, to help our gurus out there, many of them are in medical startups, medtech startups, or innovative teams. I'm wondering what advice you would give to innovators out there who are building solutions at this intersection of AI and clinical operations. Do you have any thoughts or best practices you can share with us?
Get the physicians and nurses involved early, get constant feedback from them. Now, Artisight benefits a little bit in that I'm still practicing medicine, and I'm certainly asking all of my colleagues in the hospitals that I work at for feedback. But history is littered with technology companies that have tried to come into healthcare and fix healthcare or disrupt healthcare that have failed miserably. If you're not building something that makes it better, more efficient for the doctors and nurses, your solution is going to fail. So, getting the clinicians involved early and often is by far and away the way you will position yourself for success if you're coming into a healthcare environment.
Yeah, that's really good advice. And I would think that individuals such as yourself, putting your clinical hat on for a moment, would be intrigued by novel solutions that would help make your job easier or enhance patient safety, right? So most clinicians are approachable if you come at them the right way. Are you finding that to be true?
Absolutely. And so we've kind of reached this point in healthcare where nursing satisfaction, physician satisfaction is at an all time low, burnouts at an all time high. The non clinical tasks that we're being asked to perform has reached an amount that is functionally crippling healthcare and limiting access. Everyone is looking for something that will make their day easier. If your solution requires a doctor or a nurse to do an extra 10 minutes of documentation, it will fail. So getting them involved to understand the workflows that their solution is going to integrate with is really the key. So getting them involved, making sure that you're targeting the right problems that people will pay for, that they recognize the value from, especially in the areas of clinical workflows and making lives easier for the clinicians, is really primed to see a massive explosion of solutions coming to market.
Yeah, that's so helpful. Thank you for that. So, Andy, this seems like a really exciting time for you and your team at Artisight. What does the future hold? Where are you going from here?
Just more of what we're doing. It really is, there's an endless list of problems that we can solve with computer vision and ambient listening in the hospitals. We really want to be the thing that generates data for the health system. And, to the extent we've accomplished this, we're now under contract with 414 hospitals throughout the United States, 55,000 patient rooms, 2,000 operating rooms. With that type of footprint, which is about 6% of the United States, we have the ability to generate algorithms, retrain them so quickly that we're moving as fast as we can generate ideas now. But you really have to think of computer vision and listening as sight and listening from a human. And if I could put a doctor and a nurse in every clinical environment just to watch and listen and record information about what was used, what was done, we'd be able to fundamentally change how we provide care for patients, and the optimizations that we could do to drive down cost and improve outcomes would be almost endless. So it really is just more of the same that we're doing, more computer vision, more voice recognition, adding and expanding our prediction engine capabilities to build out new clinical decision support systems where we take the data we've generated and then use it to make predictions and optimizations to ultimately improve outcomes. It's just a lot more of the same core competencies that we've been developing and deploying for the last decade.
It seems like a really exciting time for you and your team. So, Andy, first of all, I'd like to just thank you and acknowledge you for the time and preparation to be our guru today. If somebody wants to learn a little bit more about you and your team at Artisight, how do we do that? Is there a website? Or are you on LinkedIn? How do we learn more about what your team's up to?
Both, I would say, visiting us online at www.artisight.com or finding us on LinkedIn, all definitely viable options. We're going to a lot of the conferences, HIMSS, Vive Health, a lot of the OR conferences, the American Telehealth Association, the HMA events around the country. So pretty easy to bump into us at the conferences if you want an in-person meeting. Otherwise, we have offices now in 10 different states throughout the country. So if people are local, we're happy to host you for a demo on site.
Oh, that's fantastic. So, Andy, once again, thank you so much for being our guru today. We really appreciate the insights that you brought for us.
Thanks for having me, Tom.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.